Thank you, Dr. Sonal. Welcome everyone for this second webinar of ours. The first one was in the beginning of July, and a lot of time has gone in between the two webinars, but I think it's the right time for the second one. A lot of things have changed about COVID in Bombay, especially right now in Mumbai city. The number of cases is increasing, but the BMC is doing a great job in controlling it and in doing contact tracing. A lot of new changes have been done in the testing guidelines, the use of RT-PCR, the use of antigen testing, and the use of antibody testing. There are a lot of other tests which people are using to monitor COVID positive cases to ensure that the severe cases are admitted in the hospital and receive appropriate care, and the not so severe cases can be isolated at home and treated at home. So in the last month, we have been getting a lot of queries about COVID testing. There's a lot of some degree of confusion which is there in some people's minds, because there are so many terminologies and so many types of tests, and there are different types of swabs to be taken. Some tests need a blood sample, some tests need a nasopharyngeal swab. Some tests also require both swabs, which is nasopharyngeal and oropharyngeal. So I just want to clear the common misconceptions which people have. Thanks for submitting all your questions. We got about 500 questions. So I'll try and answer the most common ones on this webinar. So the topic of this webinar is COVID-19 testing turning myths into facts. Now, the whole point here is that it's going to be the first 20 minutes is going to be me speaking, but at the end of it, please feel free to leave your questions in the chat box so I can try and take them at the end of the webinar. Okay, the first thing I want to talk about is this. I'm going to go case by case. So I've taken a few cases which we have dealt with in the past few months, and then we'll talk about the test which is related to that case. So the first one is a 40-year-old male. So what had happened was this patient in his office had come across a COVID positive case about 7 days ago, and at that point of time, neither of them were wearing a mask, and he develops fever on the 7th day. Now, because he developed fever on the 7th day, he was worried whether he would be infectious to his wife, and the rest of his family, even before the fever started. So he was asking us, should I get my family tested as well? So he was under the impression that COVID it's only possible to spread COVID to other people in proximity when you have symptoms, when you have fever or any other symptoms. So that's the first thing I want to talk about. That COVID-19 is not only infectious in the symptomatic phase, that is when the symptoms come. It can also be infectious before the symptoms come, before the symptoms start to appear. That's point number one. Now, there is a difference in what I have pointed out here, which is pre-symptomatic, and what I want to talk about is asymptomatic. So when I say pre-symptomatic, it means before the person develops symptoms. So the person is going to develop symptoms, but before 1 or 2 days before that. And asymptomatic patients are those patients who will never develop symptoms, but they do have COVID infection, and they don't even realize it at sometimes, or sometimes they just have mild symptoms like body ache or myalgia or lethargy. So the first point I want to come across is that when do you get symptoms after exposure to a person who has COVID? So a lot of studies have shown that the median time to get COVID after any kind of exposure is about 5.1 days. So 5 days after exposure to a patient of COVID, most of the people develop symptoms. And over 95% of people develop symptoms 10 days after exposure. So in this case, it was 7 days after exposure. So since the incubation period was slightly longer, it means that this patient could have been infectious even 1 or 2 days before the symptoms came about. So please remember that 5 days is the average time from exposure to the symptom development, and that is called the incubation period. COVID can also be infectious in the pre-symptomatic phase, and yes, many patients who are asymptomatic can also spread COVID. So that's the first thing I want to talk about. So like I said here, it can be infectious 1 to 2 days before onset of the illness, and the incubation period is about 5 days. The second case, now everybody's talking about antibody testing. Is it useful? It's adding to the confusion. nobody's clear on what it is to be used for, whether they should use it for diagnosis, whether they should use it for surveillance, what is happening. So there's another patient here. So he had done what we call a total antibody test. So in that case, his housing society found out, and they started telling him that he's infectious and he has COVID, and that he should remain isolated until the antibodies turn negative. Now, total antibodies, as we all know, what do we mean by antibody? First of all, it's something which is formed by our body as a response to an infection. In this case, COVID antibodies are formed as a response to COVID infection. There are multiple types of antibodies. According to, if you take the example of dengue, the first antibody to form would be the IgM antibody. This is followed by the IgG antibody. In the case of COVID, there is not much of a difference in the onset of formation of IgM and IgG antibodies. They are just formed 1 or 2 days apart, or sometimes slightly longer. So when we talk about total antibody testing, it means that you're detecting all those antibodies, in whether they are IgM, IgG, or IgA, when they have matured enough. So this is a good screening test for people to check if they have antibodies. But what does it mean? Do you have COVID or do you not have COVID? That's what everybody wants to know. So first thing you have to understand is the report which comes out looks like this. Okay, you can see this reactive, right? So reactive means COVID antibodies are present. If you look at the right over here, anything more than 1, it is reactive, which means detected. Okay, so can you use antibody test to diagnose, or should you use antibody testing to diagnose COVID? The answer is no. It is not a good test to diagnose COVID. So what is the use of it? It will only tell you whether you have been exposed to COVID infection in the past, in the recent past, or sometime before that. If you get a total antibody test positive, it means you have been exposed to COVID. If you get a IgM test positive, okay, it means you have been exposed to COVID in the recent past. If you get a IgG test positive, it means you have been exposed to COVID slightly before that. But overall, all these tests will tell you, that you have been exposed to COVID. So why can't you use COVID for diagnosis, COVID antibodies for diagnosis? The most important thing you have to understand is that for the antibodies to develop, it starts to develop at the end of the symptomatic phase of COVID. So like I told you before, it takes 5 days for you to develop symptoms of COVID, and antibodies start developing on a median, say between detectable antibodies start developing anywhere between 10 to 14 days at a level which you can properly detect them. So by the time you start to test for antibodies, your symptoms have subsided, right? So what does that mean? Your virus which was there in your body has responded to this virus. You have started improving, and the amount of virus in your nasopharynx and in your body has started reducing, and then your body has started forming antibodies. So you have had antibodies, you have had a COVID infection, but that COVID infection is on its way out. So you don't currently have COVID, you had COVID, and that is why you have developed antibodies. So when a person tests positive for antibodies, it is not going to tell that person that he has COVID now. It is just going to tell him he had COVID sometime in the past. There can be confusion in terms of, then why should you use it for diagnosis? So please understand that if you test positive for total antibodies, you are not suffering from COVID now in 99% cases. Okay, so do not worry. So when you have to diagnose COVID, the only thing you can do to diagnose COVID, which is a gold standard right now, is the RT-PCR test. I will come to the antigen test later. Now, another very critical thing. Now, 65-year-old female who was admitted in a hospital with fever and breathlessness. The fever was about 101, and history of fever since 4 days. The sample, so many hospitals have started doing what we call as antigen testing. Antigen testing is a very simple test. It takes less than half an hour to do the entire test. It requires a nasopharyngeal swab. When I say nasopharynx, it means my nose and my throat, the posterior part. I have to put the swab through the nose and touch the part of the throat. So it's called nasopharyngeal swab. I need to take that swab and I need to put this on this card in a buffer. And if 2 lines are formed, that means the test is positive, antigen test is positive. So in this case, if you see, the result was dispatched as negative. But the lady had fever, she had breathlessness, the oxygen saturation was low. So they had put the patient on oxygen support. So this is how it looks. If you see on the left side, which is positive, the control and test line will both come positive if it's a case of COVID. If it's negative, then only the control line comes positive. And if it's invalid, then the control line also doesn't come positive, and only the test line comes positive. So you have to repeat the test. This same sample was sent for PCR on the same day, and it came out to be positive. So what is going on? Why is the antigen test negative, and why has the PCR come positive? So here, to understand what has happened here, is we have to talk about what we call as sensitivity and specificity. So if I take 100 cases of COVID, positive cases of COVID, I know these people have COVID. And if I have a test which detects all 100 of these as being COVID positive correctly, then this test is called 100% sensitive, right? But if there is a test which only detects 50 out of those 100 as positive, and it gives the remaining 50 as false negative, then I would say that the sensitivity of that test is around 50%. So what has ICMR correctly advised in the case of antigen test? They have said if there is a high degree of clinical suspicion that this patient has COVID, you can do the antigen test. But if the antigen test comes negative, you have to do a PCR, because the sensitivity of the antigen test is only around 50%. It varies from kit to kit, but the average is around 50%. So the antigen test it is not a perfect test. In fact, it can miss out quite a large number of positive cases. And these symptomatic actually who are positive and have been given as negative, false negative, have to be retested on PCR. On the flip side, if you get a case of antigen positive, what does it mean? Then you can take this case as being positive, because the specificity of this test, that means the chances of it correctly diagnosing the ones which it has given as positive is very high. It's almost 99%, which is almost similar to PCR. So when an antigen test comes positive, you know for sure it will be COVID. You do not need to recheck the same on a PCR. So I hope that is clear. So this was the third myth I wanted to break, where you say that antigen and PCR tests are the same. They are not the same. PCR will still be the gold standard. Antigen test is going to be used in places where you need the result quickly for admission purposes. But you have to understand the drawback of that is that it can give false negatives. And any symptomatic, highly suspicious case of COVID, and it is antigen negative, needs to be retested on PCR. So this is what I wanted to cover. Obviously, the PCR test, again, a lot of people say, is it a perfect test? I will say, no, it's not a perfect test, because in the diagnostic field, no test is perfect. Please remember that. Now, this is another thing. Now, a lot of you have asked, how long should we, suppose somebody tests positive for COVID, should we retest it immediately? How often to retest it? Do I need to have a negative report before isolation is ended? Even the symptoms have stopped. If it's so what do I do? So this is one case which may shed some light. So first of all, there was this family where a 55-year-old patient who had tested positive for COVID. He had COVID 3 weeks ago, and the symptoms lasted for around 3 days. So the symptoms were 2 days, which was a mild fever and just body ache. And then he didn't have anything, and he was not exposed to anybody else in his house. So the point is, 3 weeks had gone, which is around 21 days. He was symptomatic for only 2 days. So that means for 19 days post the symptoms subsiding, he was actually asymptomatic. What do you do now? This is the myth I want to break. So once the symptoms have subsided, okay, after having a symptomatic case of COVID, people think that the patient will continue being symptomatic for 30, 40, 50 days, right? So you have to do testing before you sort of discharge. But so this is something which I want to talk about a lot. So please understand, first of all, right? When a person becomes asymptomatic for 3 to 4 days, the chances of him being infectious after that are quite low. So when should you repeat the test, or should you repeat the test rather? Number one, for any case which is mild to moderate, like this patient over here, if you've got tested as positive now, then at least say 14 days after, it's written 10 days, but I would say 14 days after symptom onset, and at least no fever or any symptoms for 48 hours, you can safely conclude that this patient is going to be asymptomatic. But if the patient has severe illness, where the patient was on a ventilator, or he has other comorbidities like kidney disease, which can affect the severity of COVID, in those cases, you need to take precautions for up to 20 days after symptom onset. So there are two different things. For mild to moderate cases, it would be around 10 to 14 days. But for severe cases, it would be around 20 days. And for those who never develop symptoms at all, but they have tested positive, then again, 10 days would be the degree of isolation. Okay. So you need to test in cases which are severe before you discharge or before you do anything, before you end isolation. For mild to moderate cases, about 14 days after and 48 hours after symptoms are gone, you do not need to necessarily test. Then, yeah, so this is what I wanted to say. So imagine two cases now. There is a 40-year-old male without any comorbidities. So no diabetes, no hypertension, no kidney dysfunction, no liver dysfunction. And he had symptoms for 1 or 2 days, which were again mild in nature, and 10 days after symptom onset. The second case is a 75-year-old male, patient of kidney disease, chronic kidney disease on dialysis, and it's been 15 days since the symptom onset. So according to the previous slide which I showed you, which of these would you need to test right now? So I would say number 2, which is the 75-year-old male, because it is a more of a severe COVID and he has comorbidities, and then you would need to test before you sort of ended isolation. But in the earlier case, if his symptoms have subsided and already of many days have gone, then you don't need to test. A lot of you will ask me, there have been many cases in which after 25 days also the COVID test comes positive, and what does it mean? So I'll come to that. So this was the myth I wanted to end. In every case, you do not need to use PCR to stop isolation. Please remember that. For severely immunocompromised as in when the immunity is low because of some other comorbidity, you can use a test-based strategy. But for mild to moderate or asymptomatic, you do not need to use tests to end the isolation. Now, does it mean now the next case I want to talk about is, do COVID antibodies confer immunity on the person for sure, or do they not? And does it mean that if you have COVID antibodies, you have immunity, right? Immunity for COVID is in general, immunity for any infection in the body, it is a complicated matter. Most important to understand that there is something called as lymphocytes, which are types of white blood cells in your body, which are very important. There are broadly two types of lymphocytes, which are the B lymphocytes and the T lymphocytes. So the B lymphocytes are those which mature and they give rise to antibody formation, which we are detecting in all these tests. And so this is one form of immunity where antibodies are formed. Now, the other type of immunity is called T cell immunity or cell-mediated immunity, which is a different mechanism and which may also be playing a role in COVID. It cannot be currently detected by the antibody test. It is a different type of immunity, and it also plays a role in many diseases. So, does it mean that antibodies give immunity? For how long? And does it mean that if the patient is exposed to COVID, has had COVID, and does not develop antibodies, what does it mean? So let us just see. So, first of all, we need to understand that this, like Dr. Sonal correctly said, this disease has been around for less than a year in India. We have limited knowledge of the immunity patterns through antibody testing. There are multiple studies saying that antibodies do confer some degree of immunity, and T cells also confer immunity. So somebody who has had COVID is very unlikely to get reinfected in the future. We do not understand today whether the antibodies, when they are formed, do they give immunity for more than 3 months or not? Because we are able to study currently antibodies for only for a duration of 3 months. As time goes on, there will be more clarity of immunity due to antibodies, and the guidelines will then be revised. So we have to understand antibodies. If you have antibodies, yes, you have some degree of immunity, but it does not mean that you need to go about your daily life as if now you are completely invincible from COVID and immune from COVID. You need to still follow the same precautions, because the CDC has also advised that having antibodies is not an immunity passport. Okay, so you may have some immunity, but you cannot assume that it's going to be so perfect and start roaming around without a mask, please. Sorry. Then again, this is a very, very common issue which we face. A lot of patients, I understand, they are very anxious. A lot of clinicians are very anxious. So as soon as they start getting fever, they say, we want to do the test today. on day 1 of fever. Okay, the test comes negative, and then they ask us, how did the test come negative? I have fever and I have been exposed to somebody who has COVID. So why should the test come negative? So it's very important to understand that this is a virus which is actively replicating in your nasopharyngeal tract. Your body sheds variable amounts of virus depending on the stage of illness which you are at. So like I told you, it takes about 5 days for you to develop symptoms. In most cases, sometimes it can be longer, sometimes it can be shorter. Once, before you develop symptoms, you can start shedding the virus, but may not be in very large quantity, so you can detect it by the test, number one. So when do you do the test? Let's take this thing. There are two cases actually, but in one case, the patient underwent a test on day 1 of fever, which is the previous one. And the second case, he underwent test on the 4th day of fever. So which one do you feel is more likely to come positive, assuming they both actually have COVID-19? So the day 4 symptoms is the one which comes positive, and the day 1 of symptoms is the one which can come false negative. Okay. So I will show you a study which was done. Sorry. Yeah. Can you see this? I hope you can see it. Yeah. So if you were to see this here, that between 3 and 4 days, okay, between 3 and 4 days of symptom onset, it would be the right time for you to do the test. Before the symptom onset, then it is not going to be possible to detect it, because the sensitivity of the test only is close to very high when it has been 3 to 4 days. Please remember that. Don't try to rush into doing the test on the first day. Wait, because you will get a false negative and then you will have to repeat the test. So wait for 3 to 4 days of symptoms for you to do it. Okay. Now, a lot of people are asking, what does it mean? What does this whole thing mean about antibody testing? If you have one test positive, what does it mean? Okay. So please understand that the antibody test in isolation, one antibody test of isolation, if you get it positive, it really depends on two things. Okay. Number one, it depends on the prevalence of COVID-19 in our population. So when I say prevalence, it means what percentage of the population today in that locality has exposure to COVID-19. Higher is the prevalence, more is the likelihood that a positive antibody test is actually positive. Number one. Number two, if I do the antibody test on somebody who has never had symptoms of COVID and it comes positive, it could be a false positive. So there's something called as pre-test probability. That means that what is the chance that the person being tested for COVID-19 antibodies will actually be positive for these antibodies. It basically means that both these things together need to be taken into consideration before you actually go in for an antibody test. When is it very high? When is the probability high? It is high when a person who has been exposed to COVID, PCR test has been positive, then comes and does the antibody test after 14 days minimum. That's number one. And number two is that the prevalence in the population, that means more than 5%, more than 10% of the population has COVID, then you can say that the likelihood of a positive test being actually positive is high. So please remember this. Randomly doing antibody tests, I would say, is not necessarily advisable. If you have had exposure, if you've had fever, but you do not know whether it was COVID, then you can still do the test. But preferably do it when you have had some exposure to COVID in the past, and then 14 days at least to wait before you do the antibody test. Yeah. Then the same thing. Does the COVID antibody test confer immunity forever? We do not know this. We know for a fact that there are cases where for 3 months at least the antibodies last. So we know for a period of 3 months it may confer immunity. Okay. Yeah. Now there have been a lot of questions about CT scans and CT scans being used to diagnose COVID, CT scans as a confirmatory test for COVID. So we must understand one thing, that CT scan is an indirect modality of any lung pathology, right? Does the CT scan tell you that there is lung involvement due to some disease? Yes, it does tell you. Is it very useful in COVID cases, early diagnosis of COVID? I would say still yes. But the American College of Radiologists has said that they do not advise doing CT scans as a diagnostic test for COVID. They can use it for hospitalized patients who are symptomatic and who have clinical indications for CT to check whether the patient has pneumonia, because the same appearance on CT scan can also be there due to H1N1 and other coronavirus infections as well. So still the gold standard diagnostic test of choice remains to be RT-PCR. Please remember that. So then I want to take another very, very important case. I told you that there are total antibodies, there are IgM, IgG and IgA antibodies, right? In most of the illnesses, we say that IgG would be the protective antibody, while the IgM would be a marker of recent infection, right? So when you have a total antibody case positive, does it mean, look at these two cases over here. There was one 55-year-old patient who has a total antibody reactive and IgG antibody also positive. And then you have a 25-year-old patient who has a total antibody again reactive, but the IgG is negative. Now, why is that? So, number one, this patient A may not have formed IgG. That could be one of the reasons. In fact, that is the most common reason. So, I would say that this patient would repeat the IgG antibody after some time to check whether he has formed it or not. So, this 45 value which you see, you don't know whether it is IgG, IgA, or IgM. It's detecting all three. So, it will only tell you that yes, you have been exposed to COVID. If you want to be sure whether you have IgG antibodies, then that test has to be done separately. So, in this case, the test was done and it has come negative. So, repeating the test would be the only solution to this. So total antibody does not mean that you have IgG in all the cases. There have been cases where total antibodies are positive and IgG has been negative. Please remember that. Yeah, so I already mentioned this. Now, people are saying that a lot of these conflicting news articles come out that there is no evidence at all of COVID antibody, of any sort of immunity against COVID. So there is just anecdotal evidence as of now. In the journal called Nature, which is a very reputed scientific journal, recently there was a mention of this. So it's a very scary case actually. So there were these sailors, almost 122 crew members in the United States Navy ship. It's a fishing boat rather, not a Navy ship. So they had all been tested for RT-PCR and for antibodies before embarking on the expedition, fishing expedition. But then what actually ended up happening is that when they had all tested negative for PCR, and they had tested, only 3 people had tested positive for COVID antibodies. Okay, so then they said, okay, nobody on board will have it, so let us go and carry out the expedition. When the ship set off, unfortunately, there was an outbreak with one person developing fever, and then they realized that this is actually COVID. And as you know, it is highly infectious, so almost 104 members of the 122 crew members were infected. But what is very, very important, that the 3 people who had antibodies were not infected. So they have made a corollary and said that yes, because they were not infected, there is some indirect evidence, or there is some evidence that COVID antibodies do lead to some degree of immunity. And remember, antibodies, when we detect, there are multiple types of antibodies, like I said, apart from IgG, A, and M. But there are something called as neutralizing antibodies and sterilizing antibodies and a lot of other things, which is a little technical, so I won't going into that much right now. The findings of the Nature journal have not yet been peer reviewed. That means it has not been studied very rigorously by scientists. So please take it with a pinch of salt as well. Now, sorry. Yeah. So this is just a quick summary of COVID tests. So if you see, the primary clinical use is the most important thing, right? The primary clinical use of nucleic acid tests, which are the RT-PCR tests, is diagnosis of current infection. Antibody detection is used of prior infection of at least 2 weeks duration. An antigen test is also for current infection. So please understand that antibody tests require blood, while antigen and PCR tests require nasopharyngeal swabs. Okay, it's very critical to understand the difference. And okay, there's some part of it which has been cut out, but in general, do PCR and antigen tests between 3 to 4 days of symptoms. Do antibody tests after at least 2 weeks of symptoms. and IgE testing after that, after your total antibody test comes positive, or even directly after 2 to 3 weeks. It's very important. Do not do COVID tests, especially RT-PCR or antigen tests, on the first day of symptoms. Then a lot of people ask, when do we? Are there any other tests to judge for severity? Right? How do I know that this case of COVID is more severe than the other one? I would first say that clinical presentation and the clinicians are best placed to judge this, because they are examining the patient, they are monitoring the pulse oximetry, I mean the oxygen saturation, they know on auscultation of the chest how much is the lung involvement and all those factors. So first emphasis would always be given to the patient's symptoms, how breathless is the patient, and the clinical examination. After this, if the clinician says yes, now it has been 5 days of fever, 3 to 4 days of fever, the patient has tested positive for COVID. Now I also want to see how severe is the COVID. There are some other tests which we can do. I do not think that these need to be done in all COVID cases at all. They need to be done in moderate to severe cases to see how severe it is, clinically, when I say. So what are these tests? There are too many tests, and doing all of them is a waste of time, energy, and money. So please just stick to the basics. That would be CBC, IL-6, and ferritin. That too, you don't need to do all. Your clinician will be the best person to tell you which test to do. But in general, if all of these are very high, or one of these is very high, you can say that yes, it has been, there is a more severe case of COVID. And a simple CBC, how does it point towards COVID? Because in many COVID cases, we have seen that the lymphocyte count, absolute lymphocyte, like I said, as a type of white blood cells, the lymphocyte count in many cases of COVID is very low. It's low, rather. And that points towards COVID. And this is all okay because right now we have a lot of COVID infections. But please understand, today there is a lot of malaria cases also. There are a lot of malaria cases also. So many times people are thinking it could be COVID, but actually it ends up being malaria. So that is why here I mentioned that you do CBC, MP, and CRP, which is the most basic test first on day one of fever, if you want to do it, if the patient has fever with chills. If it's malaria, then of course you can treat with as per malaria. If the CRP, which is an indirect marker of inflammation, is high in COVID, but it can also be high in malaria. So that's why I'm saying do it on the first day. If malaria is negative and CRP is very high, then the CBC shows low lymphocyte count, then you can do a COVID test on day 3 or 4 of symptoms. If the case is moderate to severe, then you do IL-6, ferritin, D-dimer, what I've written there, between 5 and 10 days. And then you see clinically whether the patient has to be admitted or can be isolated at home. So other tests are not going to be. The third one, sorry, I don't think you can read the third one. The third one is oxygen, O2, I mean pulse oximetry. And third is written etc., which is the other test. Yeah. So between 5 and 10 only if the clinician advises, then do these tests. In all cases where there are asymptomatic or mild symptoms, you do not need to do these tests. Some people are asking also, what do these levels of antibody mean? So when it's 1, what does it mean? When it's 0.8, what does it mean? When it's 50, what does it mean? Okay, so when you higher the level of antibodies, okay, first of all, remember one thing. This test is just telling you reactive or non-reactive. When you say reactive, it means antibodies are positive, antibodies are detected. And non-reactive means antibodies are not detected. So when I have detected the antibodies, okay, then I need to, if I see a very high value, which is like 60, 70, 100, what does it mean? It means in most cases that this infection has been there for 2 to 3 weeks and the body's response has been slightly higher. Is it telling you the exact quantity of antibodies? It is not. It is not telling you the exact. It is just telling you that the antibodies against COVID are higher. Whether they are IgG, M, or A, it is not telling you. Okay. Yeah. Yeah. Now, another question is, suppose I have done COVID tests today and it has come positive. And after 16 days, I have antibody test. If I've done the antibody test and it comes negative, what does it mean? Please remember, there have been cases in which if the patient has had asymptomatic COVID or mild COVID, then the antibody response is not that much. It is not that high. So there are cases in which the antibodies may not even be detectable. That's number one. Number two, if the patient is symptomatic for a long duration of time. So if he's, like I said, most cases 5 days is the incubation period. But if the cases, the symptoms are going on for 10 days, 15 days, then the patient to develop antibodies may take slightly longer time. Okay, one question is, what is the significance of CT value? That's a very, very good question. First of all, what does CT value mean? It means cycle threshold. Okay, it basically is the, when you say cycle, what is this, which cycle are we talking about? The test which we all are talking about here is called the polymerase chain reaction, or the PCR, or RT-PCR as you know it. So for any test to detect a case as positive or negative, there is something called a threshold or a cutoff, right? So in case of PCR, it is called a cycle threshold. So at which cycle in the PCR reaction are we getting, is the machine telling you that yes, this is positive? That is called a cycle threshold. So basically, if I get a cycle threshold value of 30, it means after 30 PCR cycles, the case has been detected as positive. If I get it at 36, that means after 36 cycles of PCR, the case has come positive. And if I get it at 24, that means at 24 cycles of PCR, the case has become positive. There have been many people saying that when the level of CT value is less than 24, the case is very severe and highly infectious. And when the CT value is greater than 24, matlab 27, 28, 30, then it is not as infectious. See, theoretically, it's all fine, but according to the ICMR also, we will ask someone to share the ICMR document. Dr. Alvin or Dr. Sonal, can you share it on the chat, please? The link to the PDF of ICMR. Yeah. Number one, they have said to not base severity of the case on the CT value. Okay. Why? Most important thing is that if 5 labs are using 5 different kits of PCR, they will give for the same sample 5 different CT values. Number one. In the same patient on the same machine, if I run the test different times of the day, it can give rise to a different CT value. Number two. Number three is that it depends on the time in the patient's illness where we have done the test, because it can change according to the timing of the test. On day 3, it may be different. Day 5, it may be different. These are the 3 most important things. Do not use the CT value as a marker of clinical severity. What can tell you about clinical severity? The clinician. He can examine the patient, and the patient himself will understand whether the symptoms are very serious or not. So do not go by the CT value. Do not go for by the CT value as a marker of severity, please. The only way, and there was another video floating around which says that CT value means viral load. Okay, lower the CT value means higher the viral load. Again, it is very variable. It is an indirect marker of viral load, yes, but when we have cases like HIV, we directly measure the viral load. Okay, it is a quantitative test. The HIV viral load is a quantitative test. What we are currently doing for PCR is a qualitative test. That means every lab can simply tell you detected or not detected. It is not actually measuring the viral load separately. So a CT value can be an indirect marker of viral load, but to base every clinical decision on that is not going to be possible. Okay. Second, now somebody is saying PCR or CRP. CRP early, matlab day 1 or 2, PCR day 3 or 4. So CRP is also important. It's a very economical test. It can tell you if the inflammation level is very high in the body. Yes, CT value comes in the PCR test. The cycle threshold is given in the PCR test. Is PCR the best and confirmation test for COVID? Yes, it is currently the gold standard. It is a confirmatory test for COVID. So as a dentist, should I get all patients to do antigen test before starting their treatment, converting that there is asymptomatic? Okay. The graph which I showed you about the sensitivity of PCR, which is highest on day 3 and 4. If you use antigen testing for screening of dental patients, it's fine if the patient is symptomatic, okay, and if it's positive. But if your antigen test gives you a negative result, are you going to confidently say that it is a negative case? The answer is no, because you have to get it checked on RT-PCR if the patient even has fever. Okay, so you can do the antigen test because it is quick when the case has fever. Then the sensitivity is at least 50%. When there is asymptomatic case, then the sensitivity of antigen testing is even lower. So basically, what you will be getting is you will be getting a lot of false negatives, and you will be operating thinking they are negatives, but they are not actually negative. They could be positive. So it really depends on your comfort level and whether you have the ability to get negative antigen test results confirmed by a PCR. If symptoms are common for malaria and COVID, if patient has body ache, dry cough, and body ache in addition to shivers and fever, see she's asking if the symptoms are like malaria, should you get tested for COVID? Now, let me just say one thing, that COVID has fever as well. COVID can have chills. COVID can have body ache. It's very difficult for you to understand on the basis of just symptoms alone whether there can be COVID. And since there is a pandemic going on, you have to have a high degree of suspicion for COVID. So you can do, as I've shown you in the chart. Um, okay, I think people are asking what is NS1. Sorry. So NS1 is the test for dengue. It is an antigen test for dengue. So it can come positive even in the first 24 to 48 hours of the fever. So in the monsoon in Mumbai, on day one, instead of doing the COVID test, if the clinician suspects, you'd rather do that. So coming back to your question, if you have ruled out malaria on day one with these tests, then yes, you should have a high degree of suspicion for COVID as well, because currently the prevalence rate is in Mumbai is also increasing. We are a family of 5. 3 of us were COVID positive and isolated. Other 2 members didn't develop symptoms. Do we need? Sorry, I didn't. Okay, do we need to check for them, recheck for them? See, what you can do if they don't have symptoms now and if they're isolated, then you do not need to test. Wait for 2-3 weeks and then do the antibody test straight. See, if they don't have symptoms today and if they're isolated from you, then it's not mandatory for you to test. Let's put it that way. When should you test? If the person is 70 plus with comorbidities, and it has been at least 5 days since the person has been exposed to the person who has had COVID, and if there was no mask which was used, and you are there's a lot of comorbidities, then only you should test. Otherwise, I don't think you should be testing for PCR for everybody. No, antigen does not come positive on day one. It has the same sensitivity issues as the PCR. So even for antigen, 3 or 4 days, third or fourth day would be important. Yeah, so I was asymptomatic but tested positive on 27th and then tested negative on 11th and 15th August. My antibody test was non-reactive. So if you, like I said, it takes some people who are asymptomatic, who have very mild to moderate symptoms, may not form antibodies at all. Okay, or the antibodies may disappear after some time. So most of the antibodies are formed when the patient has had moderate to severe COVID. So it does not mean that if you have had COVID, every single person will develop antibodies. COVID testing in children affects on children. So the guidelines for COVID testing remain the same for children or adults. What is the relationship between D-dimer and COVID? D-dimer is a test which detects the formation of small clots in the small blood vessels, small to medium-sized blood vessels in your body. Whenever there are a lot of clot formations in the blood, in the vessels of your blood, the D-dimer level will increase. So they say that COVID-19 is associated with clot formation, and clinically, rather, if you measure the D-dimer level and it is found to be high, then you have to understand that there could be clots in the body, and that is why in hospitalized patients, they start the patients on what is called as low molecular weight heparin. So that is the idea of D-dimer testing. So what will you prefer for testing the antibodies? CLIA, ELISA, IgG, lateral flow? That's a good question. There is a lot of difference actually between the sensitivities of lateral flow method and ELISA, IgG, and CLIA. So ELISA and CLIA would be obviously superior. They have a better sensitivity and specificity than lateral flow. Lateral flow, there are so many kits on the market. God knows who has validated them, and it's very difficult for anybody to understand which is the right one to use. Okay, so there are a lot of sensitivity and specificity issues with lateral flow. When you say lateral flow, you're talking about the simple cart test for antibodies. So there's a lot of validation which needs to be done before you take antibody testing by cart test very, very seriously. I would say that stick to ELISA or CLIA. How many days a positive person should stay separate for the family? Like I said, if it's a mild case, then 14 days. If it's a severe case, then at least 21 days or so. On second day of fever, lymphocyte count is low, CRP 60, D dimer is okay, ESR 61, MP negative, and also antibodies 111. Then what is the chance to have COVID? See, there are two things. Okay, a lot of people are wondering whether it is possible to get reinfected by COVID. So current data says that for at least 3 months, it is highly unlikely to get reinfected by COVID once you have been reinfected. Like I said, we do not have data for beyond 3 months. So after 3 months, if you have developed fever after being positive for COVID, then please repeat the PCR. If it's less than 3 months, you do not need to repeat the PCR. Was asymptomatic patient test positive 27th and then tested negative on 11th and 15th August. Antibody test was not traveling abroad. Did again my COVID test. So you did your COVID test or you're going to do your COVID test again? Please, can you clarify the question, Ms. Kapadia? When COVID test to be repeated for asymptomatic patient? Like I said, for asymptomatic patients, 10 days post the first COVID test, I don't even think you need to repeat it. The guidelines also say you do not need to repeat it. But if you really feel that for your peace of mind, then you can repeat it after 10 to 14 days. But please remember, it's a very notorious phenomenon that I will come to, that there are some cases which continue to test positive even after 3 weeks or 4 weeks. But they did a study to say these cases, let's say first day of symptoms they tested third day of symptoms they tested positive, and again the COVID test came positive after 3.5 to 4 weeks. So what does it really mean? Is this patient infectious to him, to other people, to his family, or not? So they took such patients and they took the swab from those patients after 3 to 4 weeks who have tested positive again, and they tried to culture them. Okay, that means they tried to grow them in a viral culture. So they were very surprised to see that most of these cases did not grow in culture. So then they started thinking that actually this may be either the inactivated or dead virus, or it could be a virus which has lost its infective potential. So if you get a positive test after 30 days after doing the first COVID test, do not panic. Highly likely that you are no longer infectious. Then sensitivity and specificity of antibody test and PCR. Okay, so when you say sensitivity, the PCR has to be done on the third or fourth day to be sensitive, which is more than 95%, at least 90% of antibody test with one test. Okay, with one test, if the disease prevalence is above 10% of your population, I would say the sensitivity, and forget about sensitivity, talk about if a test comes positive, how likely is it that it is actually positive? That is the most important thing we have to understand. So if for an antibody, a single isolated antibody test in a population which has a prevalence of 10% COVID, a single positive antibody test has only a 70% of actually being true positive. So what has the CDC advised? There's something called as orthogonal testing. That means you test now, and again, if it comes positive, then 2 weeks later you repeat the test. If both the tests are positive, then you have a 99% positive predictive value. That means actually this patient has got antibodies. So the sensitivity of a single isolated antibody test, positive predictive value, is not very high, but of two antibody tests, it is much higher. If RT-PCR can be false negative, yes, it can be if you do it too early, if the swab is incorrectly collected, if you do it too late, it can come false negative. So these times it can come false negative. So please remember, on the third or fourth day of fever is the best thing. If you test a RT-PCR after 10 days, or if you test it on the first day, it can come false negative. COVID positive patient remains infective for as long they could be symptomatic. After 48 hours of being asymptomatic, or at least 72 hours, then the chances of them being infectious are much lower. Um, is there any cross reactivity with other virus? Yes, there is cross reactivity, especially for antibody testing with other common cold viruses also and other coronaviruses also. So please understand that that is one of the drawbacks of the antibody test. This cross reactivity with other viruses can cause a false positive reaction as well. We four are all positive. Can we go for pool testing? Pool testing for what? Can you please clarify? And why would you, if you're already tested positive, then you do not need to repeat it now. So, how long does the fever last, and should the test repeat after 20 days? Only if the patient has severe COVID and has a lot of comorbidities, then you need to repeat the test after 20 days. If it's a mild to moderate or asymptomatic case, you do not need to repeat. If it's a mild to moderate case, then in that case, with mild to moderate symptoms, you can assume that after 40 to 72 hours after the symptoms are subsided, you do not need to repeat the test also. Yes, that's a good question. We get typhoid, IgM, IgG positive in COVID. That happens not just with typhoid, it can happen with other things like dengue also, because antibody tests are basically your immune response to a virus or whatever is there. So, similarly structured viruses can cause false cross reactivity with other viruses, and that is why not just viruses but other organisms as well. Because of that, there can be some degree of false positive cases where tests like IgG, IgM for typhoid can also come positive. Actual virus, yeah. If you don't have any symptoms and still you get tested positive, yes, it can happen, because, like I discussed before, asymptomatic cases also can test positive for COVID on RT-PCR. It is a known fact. Just a second, I'm just going through the questions. Uh, After 3 weeks of tested positive, when I have done blood tests, it shows eosinophilia. No. In fact, in COVID, you'll be surprised that apart from the lymphocytes being low, you can have a low eosinophil count as well. So eosinophilia is not a problem in that. In fact, it's a sign of your body recovering. Can asymptomatic COVID patients infect others? Well, yes. How, to what degree, that is yet to be seen and studied, but yes, they can be infectious to others as well. When will the patients become? I can't understand that question. Which test can distinguish between H1N1 and COVID? So see, these are different viruses, right? So in COVID test, we are detecting specifically for the COVID, for the Corona SARS-CoV-2 virus, while in the H1N1 test, we are testing specifically for the H1N1 virus. So method is the same, which is RT-PCR, but the target of the test is different depending on the virus which you are trying to detect. My coworker had fever a week back, and he came to work after a week and was in close proximity with me. I was wearing a mask throughout his COVID PCR test, came positive with CT value 20. Can I have contacted COVID? If both of you are, first of all, he came to work after symptoms have subsided. I think from that's what you're trying to say. I'm not sure. And both of you are wearing a mask. So if both of you are wearing a mask and he has come to work, say 2-3 days after symptoms have subsided, then the chances of you getting it from him are very low. So you do not need to worry. If you do develop fever, then only get yourself tested. There's high. So otherwise, if you have comorbidities and if you start getting any fatigue or lethargy, then get yourself tested. What is the lifespan of the antibodies? As of now, we know that it can last for at least 3 months. We do not know beyond that. Then, what is the ferritin test and how it helps to diagnose? So it doesn't help to diagnose COVID. It's not a diagnostic test. In fact, ferritin is what you call as an acute phase reactant. That means in any acute inflammation, whether it is COVID or it is not COVID, it rises. Okay. So it is not specific for COVID at all. Why would you use it in COVID? Is because if you know that the patient already has COVID, and then if you use ferritin and it is very, very high, then you think that the severity of COVID is more. That's all. It is not a diagnostic test. Neither is D-dimer a diagnostic test. CRP is not a diagnostic test, and your CBC is also not a diagnostic test. These are all supportive tests. They do not tell you that you have COVID. I got a fever on 3rd August and 6th August. I did a test and was positive. I'm living separately since 3rd August. Today is what date? It's the 20th. So 17 days. See, like I said, you wait for at least 20 days and you can then mix with your family if you have no symptoms for at least 48 to 72 hours, at least that much time. If you still have symptoms, you cannot mix with your family. As long as you have symptoms, after your symptoms subside, at least 72 hours, you should not be mixing with anybody. Yes, so this is a very, very critical question. Somebody's friend is in the hospital for ICU he was in the ICU for 25 days and now is the normal COVID ward of the hospital for 60 days. Yes, and he was tested positive for the 6th time. Like I said, when the cases are very, very severe and the symptoms are continuing for a long period of time, then the patient can go on testing positive for COVID. Once the symptoms have disappeared, then still the patient can go on testing positive, especially if it has been a severe case. And like I said, because of the dead virus being there, you can test positive. It does not mean he is necessarily infectious. Please remember that. So, see how long the COVID virus is shed is nobody really knows for sure. There are some cases where it stops being shed after 10 days, some cases 15 days, and some cases like your friend 60 days. So after 60 days, and if the symptoms have completely subsided and he's absolutely fine, it's highly unlikely that this patient is going to be infectious. So after recovery, at least wait for 2 weeks for a total IgG test. I mean, after the symptom onset, wait for 2 weeks for a COVID antibody test. Is it curable without treatment? As you know, majority of the cases of COVID are actually mildly symptomatic. So they recover. In a large majority of our population, people are recovering. You don't need to have any treatment. All you need to do is isolate yourself from the more vulnerable members of your family. After initial symptoms subside, they have done studies to say that they had done studies after 48 to 72 hours after the symptoms have subsided, and they tried to check whether the PCR, the virus which was isolated from the nasopharyngeal tract of those patients, was that virus, were you able to grow that virus in culture or were you not able to grow the virus in culture? In most cases, they were not able to grow the virus for culture after the symptoms had subsided and 72 hours had passed. That's how you know it is non-infective. Uh, what is the importance of IL-6? Interleukin 6 is basically a cytokine. Okay, so like D-dimer and ferritin, they say that in COVID patients, there is sometimes in severe COVID cases, sometimes there is something which you call as a cytokine storm. That means your immune system overreacts or hyperreacts to COVID infection, and it causes a lot of formation of cytokines. And interleukin 6 is one of the cytokines. So if you are collecting the sample correctly of interleukin, and if it is very, very high, then it can point towards what you call as a cytokine storm, which is could be seen in more severe COVID cases. So it can give your clinician a clue that this is a more severe case and needs to be monitored more extensively. Yeah, so there is a new saliva test announced in the US. In fact, so now the first validated tests for COVID on RT-PCR were for the nasopharyngeal swabs. There have already been a lot of studies to show that the saliva also contains COVID, and saliva test and PCR also gives good sensitivity in many cases if done on the third or fourth day of fever. Now they're coming up with some tests which are like antigen tests, which can also be done on the saliva. So they have come out with it right now in the US and other countries. Now we need to understand again, the sensitivity of the test is very important. How sensitive is that test? So how many false negatives are there in that test? Once we have that data and the ICMR has that data, I'm sure they will validate similar tests and they will also start using it in India. When is plasma treatment used? See, there are a lot of clinical trials going on for plasmapheresis. When we say plasmapheresis, we basically mean that we are taking the patients, the people who have suffered from COVID, especially especially those who have had severe COVID. Okay, they tend to form more antibodies, like I told you before. Because they form more antibodies and they recover, what they are speculating or rather postulating is that they take those antibodies, and the antibodies are present in what is called as plasma in the blood. So you take that plasma, you test to see what is the amount of antibodies, and then you give it to patients who are in early stages of COVID. Please remember, you do not necessarily have to give it in severe COVID cases or critically ill COVID cases. You give it to just recently hospitalized or people who are not very severe, so to prevent it from becoming severe. Yes, home visits for COVID are done by many labs. It is allowed by ICMR and by BMC. Yeah, I think I've answered most of the question. And if there's anything else, I would say that you all can please email us on this email address. One second. I just put it there. Is there any question which I made? Actually, it scrolls a lot, so it's difficult to keep track of all the questions. Yeah. So you can mail it there. We can, if you want this presentation mailed to you, also you can do it. And yes, we do provide home visits. Dr. Phadke Lab do provide home visits. Yes. So please, any other questions, you can feel free to mail us, and we will answer them. And if you like this presentation, you can have left the email address there as well. In fact, I'll put it. I'll put it on this as well. Um okay. So thank you, and everybody, please stay safe. And all of us are in the medical fraternity are trying our best to stay safe ourselves. And I really wish that we get through all of this. I'm sure the BMC is doing a good job, and hopefully we are on a road to recovery. And stay safe, everyone, and take care. Thank you.